morning, folks. This is the Central District Board of Health meeting for Friday, April 21st, 2023. It is now 8:30 a.m. Welcome, everybody. I am the presiding chair from Elmore County, Betty Ann Middleton, serving our county with Representative Megan Blanksma. Call the meeting to order, and we'll take roll calls starting with Ada County, Dr. Young.
Jane Young.
Raul Labrador. Dr. Cole.
Here.
Boise County Commissioner Tucker.
Hi, Tucker.
Elmore County Megan Blanksma.
I'm here.
Valley County Commissioner Hasbrook.
Commissioner Hasbrook here.
Okay, thank you, folks. We do have a quorum, and that will bring us to our action items on the agenda. Our director just did step out, so I'm going to, we did not have any people from the public sign up to speak this morning. So, good morning.
Good morning.
Russ, do we have any changes to our agenda?
No changes to the agenda today.
Okay, thank you. All right, proceeding on with new business, we need a motion to approve our March 17th, 2023 board meeting minutes. If there are no additions or corrections, I'll hear that motion at this time.
Madam Chair, I'll make a motion. We approve the minutes of March 17th.
Okay, thank you, Else. Is there a second to that motion? Thank you, Jane. We'll go ahead with a roll call for approval on that if there's no further discussion, starting with Ada County, Dr. Young.
Jane Young, aye.
Raul Labrador.
Aye.
Dr. Cole.
Aye.
Boise County Commissioner Tucker.
Aye.
Elmore County Megan Blanksma.
Aye.
Valley County Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, those minutes do stand approved as presented. At this time, we will move to go into executive session under Idaho Code 74-706 1B to consider the evaluation, dismissal, or disciplining, hear complaints or charges brought against a public officer, employee, or staff member, or individual agent, public school student. So at this time, we will ask that everybody except board members leave the room. So we will.
You have to vote. You have to vote.
That's right. We do have to vote. I'm sorry. Taking a vote by county, starting with Dr. Young,
Jane Young, aye.
Raul Labrador,
Aye.
Dr. Cole,
Aye.
Boise County Clay Tucker,
Tucker, aye.
Elmore County Megan Blanksma,
Aye.
Valley County Commissioner Hasbrook.
Commissioner Hasbrook, aye, but I think you need a motion and a second
Yes,
to go
right.
into executive.
We do.
Okay, a motion and a
And I'd
second.
be willing to make that motion.
Okay,
And I'll
do we have a
second.
second? Okay, all right. Thank you for straightening me out, folks. Okay, so having taken that motion, second, and vote, we will go into executive session at this time. Okay, thank you. We are now entering back into regular session. It is 9:35 on April 21st, 2023. So proceeding with our agenda, we will go to Laurel for our financial report.
Thank you, Madam Chair. To start off with, I would like to announce a position change in our financial unit. We've promoted Conan Chu to our new financial manager. He came to us about a year ago from Fish and Game with over 25 years of experience there. And Bailey Peterson, our past financial manager, got a huge promotional opportunity to move to the Department of Admin. And then Conan got our internal promotion to the financial manager. So really excited to have him move into the role. A little bit of a hectic time to transition into it, but he's jumped right in. And Conan, would you like to say a couple words?
I am grateful to be here, and hopefully I'll be working with these guys and making sure everything is doing fine. Thank you.
Well, thank you and welcome.
Okay, so we'll go ahead and get into the budget to actual report. And Dustin, if you could please pull up the visual, I'd appreciate it. Thank you. So starting with page 1, as you can see, the report is through the end of March, which is 75% of the way through the fiscal year. Our trends continue to stay the same with what we've seen over the past couple of months. You can see that our revenues are at 84% of budget for overall summary, and our expenditures are at about 68, and that's been pretty close to the track that we've been on through the past couple of months. Just a reminder here, at this time of the year, our rate of expenditures is usually higher than our rate of revenue because most of our revenue has been received. So in the past month, our revenues increased by about 4% and our expenditures increased by about 10%, and that's the normal trend for this time of the year. Looking a little bit more closely at our revenues, our fees for community environmental health are at 83% of budget. For FCS, we're on track at 72% of budget, bringing it to 80% overall for fees. Our contracts, both CEH and FCS, are above our planned amounts at 87% and 80% respectively. For support services, our other funding is low there at 33% of budget, and that's because we anticipate additional lease revenue, which comes in June. And the other things that go into that category, which can be variable throughout the year, are vehicle and equipment surplusing. So depending on the timing and the schedule for those, that percentage can change, not on a regular schedule throughout the year. Looking at the high percentages there in other, in community environmental health and family and clinic services, that, as a reminder, is the additional funds for opioid and ARPA money that we got early with the intent to spend them in future years. So we've seen that be high for the last couple of months, and it'll stay there. Our total revenue is still above where we planned, 84% of budget. And reminder there, we hit that really large amount in interest revenue that we, even with the adjustments that we made during budget revision, we're still far above what we plan to be at this point in the year. And Russ goes over next year's proposed budget, you'll see that we've increased our amount for what we anticipate there. Looking at our expenditures for personnel, we're right on track. Our operating costs are under our planned amount. For capital, our expenses there are also under where we plan to be. And the main thing there is the support services difference. And that's mostly due to the bathroom remodel project that we have slated for this fiscal year. An update on that is that our bidding closes on May 11th. So we should be selecting a contractor within a couple weeks of that close date. So may not have another update by the time of the next meeting, but we should have one fairly soon after that. So overall expenditures are about 8% under planned amounts for this point in the fiscal year. And we can go ahead and move to page 2, which is our comparison of where we are at this point in the fiscal year compared to the last 2 fiscal years. For our fees, you can see community and environmental health is above where it was this time for the past 2 years. For FCS, they continue to remain slightly behind where they were in March of 22, but ahead of March 21. And pointed this out last time, but I looked at the numbers again this year for our food program, or this month for our food programs in community environmental health. And you can see that we had an increase of 50,000 from FY21 to FY22, which seemed big, but this year we have an increase of 130,000, which is an increase of over 25%. So just a continued note there that our food program is really continuing to take in quite a bit of additional revenue and more growth in that program year over year. Looking at our contracts, both community environmental health and family and clinic services continue to see the sizable increases compared to the last 2 years. We expect that to continue, stay pretty consistent with that contract amount going into next year.
Question, Laura,
Yep.
before we move on.
Mhm.
That's a really big jump in community environmental health. Can you kind of explain some of that?
Most of that, yes, I'm sure I can get into that.
Go ahead.
Most of that is that's the ARPA and the opioid money just showing up in a different form on this page. So that's where most of that is. There are some additional grants that we've gotten, working with our grant writer that go into that as well. They show up in that contract section, but those are the primary ones.
Thank you.
Looking at expenditures in the right column of the page, our personnel is just under, about 3% under where we plan to be. And then operating costs, TMB and capital outlay are all under, as we looked at on the other page as well. Moving on to our cash balance statement. Not much of a change in our special projects. The only change from last month is that we have used all of the funds for the completion of the Boise office remodel. As of last month, we still had just a couple of new pieces of furniture that had to be ordered, some very small other projects that were being wrapped up. Those have all been completed. So no more funds left there. We have had one meeting for our environmental health system upgrade to get things kicked off and to determine what work was going to be put out to contract to start with for that upgrade and what would be internally. So I expect to see more funds spent there over the next few months. And then, of course, there is no change to that employee retention number either.
Question on that?
Yes, go ahead.
So that 36,000 that's left, is that going to go into cash carryover, or are you going to keep it there? I mean, are we done with that employee retention?
Madam Chair?
Yes, go ahead.
We anticipate that when we make our carryover requests in August, we'll have a plan for what we would do with that money, if it would go back into the undesignated cash, or if there would be a designation for it, continue the program. When we initially set it up, it is a program that we wanted to continue year over year, and would expect that
Okay, good.
we may do that again.
Thank you.
So to summarize here, our other reserve fund balances have not changed. So our cash balance at month end minus our reserve funds leaves us a balance, an undesignated cash balance of about 3.5 million.
Laurel, on our operational reserve funds, we came up with that number some time ago. Is that still adequate for our monthly operational with the changes we've seen in our communities?
Madam Chair, that number, we have revised it a little bit. We did probably, not sure if it was 6 months or a year ago. It would be something to look at again and make sure that we still have that, or hitting that 3-month target amount. Assuming that that's still the number that the board wants to have in the operational reserve. But yeah, it would be a reasonable time to look at it and reassess that.
Madam Chair.
Yes.
You know, I know Russ is going to be coming out to the counties here pretty quick, asking for a bump in the budget. And my concern is that some of the commissioners are going to see this unrestricted fund of $3.5 million and go, why do you need more money? How are we going to answer that?
Madam Chair.
Yes, go ahead.
So that money it's unrestricted cash now, but what Laurel talked about is that gets drawn down because of our revenue that came in. So by the time you get to the end of June, that's going to look a lot different. We're not sitting on that much cash on June 30th.
So Madam Chair, when are you going out to the counties? This month?
May.
In May. So it might pay you to have an estimate of what that number might be at the end of June.
Madam Chair,
Yes, go ahead.
Commissioner Hasbrook, Laurel is actually working on it. I made a request, I think, yesterday, so.
Very good.
Good. So you guys are ahead of me. That's awesome.
Not too far ahead.
I think it's a legitimate question and it needs a legitimate answer.
Absolutely.
I have nothing further, Madam Chair.
Any further questions or discussions for Laura?
I have a question. I don't know if now's the appropriate time when we're talking about the FY '24 budget, but I want to know how much money is being spent in each county. Because we're asking Ada County to up their amount given, which will mean for them that they will have to, if they agree, if everybody agrees, which I don't think they will, but if they agree, it means that they're going to be asking for property taxes to be increased for their constituents. How much money is being spent, percentages in Ada County, in all the different counties? Do we have that information?
Madam Chair?
Yes, go ahead.
The simple answer to that question is no, we don't. And there are several examples of why, and Russ and I have spoken about this recently, but just a couple of examples. So like when we have an inspector go out and do some work in Elmore County and some work in Ada County, they don't code their inspection time differently based on what county they perform the work in. They code it to the PCA, to the funding stream that they're doing the work in, and the funding streams aren't differentiated on a county level, it's on a program code level. So there isn't a way to go to every person in the agency and determine how their time distribution is then distributed between the counties as well. So just very simply on the personnel and the time distribution, the inspector is a really easy example because they're going between counties all the time. But it's similar for our smoking cessation work when we're going to schools in different districts, for parents, teachers, all of the programs have people that work across county lines, and we don't ever break their work down or charging codes down by the counties that they perform work in. So that example alone, I think, kind of shows why we don't or aren't able to get those numbers at that level. I think the other part of that is, the county funds are about 30 to 35% of our budget. So the other 60 to 65 to 70% of our budget are grant contract funds, federal funds that we're using in the counties that we do. So typically, I think it's fair to say that the counties are getting a large percentage of those funds as well. So beyond what the counties contribute for work to be done in their counties, there's an additional large amount, 65 to 70% of the cash flow that then goes back into the counties as well. That's above and beyond what counties are putting in. So we could make some very rough estimations of what goes into each county, but it would be difficult to separate out, and it would be an estimation at best, which I don't think gets you any further ahead than looking at about what the breakdown of funds coming in are.
Follow up. Is there a way to know the fixed cost in each county? Like you have facilities and employees and things like that.
We could look at fixed costs for facilities and employees that are permanently stationed there, yeah. Yes, we could.
Madam Chair, the other way is looking at the amount of services that are the result of,
And we do have that in the county
yeah.
reports too.
Mr. Chair.
Yes, go ahead.
So, Rella, you're feeling like there's some resentment on Ada County's part as far as an increase or the actual programs or?
Oh, no, Madam Chair, I think Ada County is going to have a problem if they're asked to increase their budget, because they've been trying as a unit to keep property taxes low, and to increase spending on the programs is going to require them to increase property taxes. So I have a feeling that there's going to be a battle over that. I would like to know what those fixed costs are. And I don't mind getting a rough estimate and knowing that it's a rough estimate for how much money is being spent in each county.
Okay, thank you, Laurel. Anything else for Laurel? Okay, thank you.
And I'm sorry, one follow-up. when you do the fixed costs, how many people work, rents and things like that. Just, I think you understood that, but I wanted to clarify. Yes.
Okay, moving ahead, we're looking at the 2024 proposed budget, so we'll turn that discussion over to Russ.
Thank you, Madam Chair. This is an action item for you to vote on today. And this is the budget, if it is approved, is what we'll be reviewing with the counties between now and May 12th. I'll go over the schedule at the end of the meeting as far as with each county. That's just a budget presentation. It's not the time to vote until the budget committee meeting on May 12th, Elmore County. So page 1 is the summary. You see a comparison from the last 3 fiscal years or the last 2 fiscal years and then the proposed budget going forward for fiscal year 2024 and see the changes. I'll go over each specific section and talk more about the changes, but a roll up is our budget proposal for FY24 is about 2% less than FY23 at $17,535,400. Going on to page 2, this is always the area I think of highest interest to the counties is if we ask for a 3% increase, which is what we've done traditionally, except for the few recession years back in 09, 010, so that the counties know what to expect. It's consistent from year to year. I believe a 3% increase is more than fair and more than responsible considering how well the economy's doing, which you will see on the next page. We do have to pay our staff. That's about 75% of our budget. And if we don't provide pay increases or reasonable pay increases for our staff, we won't have staff to do the work that we need to do. So the total proposed county funding in the box is $5,351,400. That is a lot larger than what it used to be, but that was as a result of House Bill 316 that shifted the state general fund in previous years over to county responsibility. So this is fully implemented now. You can see that basically there's been a phase in, and I won't go through all the details of how the first year there were 4 months of state general fund that continued to be included. But bottom line is we're asking for $5,351,400 spread across the 4 counties. It amounts to $155,000 $906 increase. In that box on the second to last column, you'll see how that impacts each county. So to Raul's comment about Ada County, for the first time that I can remember as being the director for 16 years, Ada County is giving a 2.5% increase if the 3% budget is approved. Obviously, that then has to be made up somewhere else, which is Boise and Valley County. So we'll turn to the next page, and you'll see market values at the bottom of the page. Market values in Ada County year over year increased by 38.24%. Boise County, 67%, which again, that's unprecedented.
Unbelievable.
Elmore County, 32%, Valley County, 59%. So I believe most of, or all of you are aware that the counties have the opportunity to increase their budget by 3% per Idaho code, plus new construction, plus foregone should they decide to pursue that money. So from a revenue perspective, I think based on market value, our counties are doing quite well. The population.
Madam Chair,
Yes, go ahead, Megan.
if I may just interject, and I think this probably goes a little bit to the point that I think Raul's making, is that I appreciate that we asked for 3% and that's great, but we're going to have to justify it based on cost, not just based on ability to increase budget. And that's been the fight over the years. And so rather than saying it's reasonable because the 3% is available, I think that we need to look at what budgetary pressures there are that require that 3% increase, if that makes sense.
Madam Chair,
Yes, go ahead, Rick.
the primary budget pressure would be if we're going to increase our staff salaries. Like I said, personnel makes up the majority of our budget. And if we're going to provide salary increases to our staff, I mean, the bottom line is, you guys know this, you've run businesses. You either increase your budget from year to year or you cut costs. And the way to cut costs is either through staff salaries, which makes up the majority of our budget, or you cut services.
Madam Chair.
Just go ahead, Al.
And I think it's important, if you go back to second things, they have reduced full-time employment down 3. So basically, we're running sharper, faster with less employees, and we're paying them more to do it. Basically how I look at this. I'm a little concerned about the operating expense. That was cost. Those have really gone up. Is that mostly due to building maintenance, building energy costs, or where is most of that coming from?
So I'm actually going to cover that
Okay,
in the detail of the budget.
okay.
Um,
I'll wait.
Madam Chair,
Yes, Megan.
thank you. If I can just make a comment with regard to personnel. I mean, this is the ongoing discussion that we keep having of, does the salary improve retention? And so just increasing salaries based upon the assumption that that's going to improve retention, I think is an ongoing discussion that we need to keep in the back of our minds.
Okay, thank you, Megan. Elk, did you have further comment?
Well, and then we kind of adjusted that with the retention policies. But I understand where Megan's coming from. I think I'll just keep my mouth shut and let's keep going.
Madam Chair, page 4. Personnel costs, salary and benefits. You'll see there was a 5.9% increase. We are planning, if this budget is approved, to provide our staff with a 3% cost of living. So all staff, regardless of their performance, unless they do not achieve, will get 3%. And then if they are at the highest performer level with their most recent performance review, they'll get an additional 2%. So basically it's 3% or 5% is what the majority of our staff will receive if this budget is approved.
Madam Chair,
Yes, go ahead.
the one I'm actually kind of concerned about is the health insurance premium, where you talk about $1,200 more employee. And I don't remember our policy as far as family members and spouses. And does our insurance, do we pay 50% of that spouse cost, 60%? Where are we on that? I don't remember.
Madam Chair, I don't know the specifics. Laurel may. I know we are part of the state health insurance plan. So it's the Office of Group Insurance. We've looked at others like the GEM plan. This plan is a really good plan for our staff. You can add your spouse or children to the plan also. I just don't know what the cost actually is. The employee's premium goes up, but our cost remains the same. We pay the same dollar amount whether all of our employees have all their spouses and children on the plan, or they just accept individual insurance, or if they do not accept insurance at all, we still pay per FTE, a fixed rate, and that's how it's structured.
Well, I know a lot of the counties, with GEM plan, it used to be we would cover, the employer would cover 60% of family members, and then they would pay 40%. And over the years, we've adjusted that back to a 50-50 match on family members. And it's saved us quite a bit. Of course, it's more that comes out of the employees' paycheck to make up that difference, but, and it was really a tough sell, but we kind of laid out in a phase plan that this is where we're heading, because if you have employees that don't have any spouses, any families, versus employees that have 4, 5, 6 kids, it's really not a fair system. And so we just said, we're just gonna pay 50% of family member premium. And we finally got to that this year, and I think it's the fairest way to do it, and I was just wondering what our policy was.
So that's our policy. We are part of the office group insurance. Central District Health pays the same per employee, whether that employee accepts. So our cost, the agency cost, is the same, no matter who's covered. The employee's cost goes up based on.
Family members.
Correct. So they would have no out-of-pocket if they do not have insurance coverage through Central District Health. If it's just individual, certain level, and then as you add, agency cost doesn't go up, employees' cost goes up. So they bear a larger share of that premium cost.
So this $1,200 that you're talking about is covered mainly by the because of employee family.
Madam Chair?
Yes, go ahead.
100% of that's covered by the agency. So that's the overall plan cost is increasing to provide health insurance coverage to, I've heard different numbers. Gary, is it 27,000 covered lives? It's a massive number.
I don't know the exact amount.
So it's a large risk pool. And if you shrink down to a smaller risk pool and you have higher cost, insurance companies don't absorb that. They pass that on to the policyholder. So, we've, like I said, you brought that up in the past, just looking at the GEM plan, which is really good for the counties. But I think comparable, the state of Idaho plan that we participate in is probably one of the better ones for coverage and deductibles and co-pays and things like that. But with the premium increase to the agency this year, the part of that 5.9% increase is close to $200,000 more it's going to cost us.
Madam Chair,
Yes, go ahead.
I guess what I'm really trying to get down to the bottom of it all is basically if it costs more to insure an employee's family, that's going to be considered part of the 3% or the 2% merit. But I'm saying you might give a 3% raise, but half or 1.5% of that is due to your medical premiums going up.
Madam Chair? Gary, do you know what, I had not heard if the employees' premiums will be increasing for this coming year, the employees' portion?
Yes, the employees' portions. So we are changing some of the plans that we have available. We are now offering a deductible plan with an HSA, which previously wasn't available to us. So in those plans, the employees' portion went down. However, if you had an employee, just a single employee, their rate stayed exactly the same. If you had an employee with dependents, then the more dependents that you add, the higher their portion of their medical premiums went up. So some of them may have went up $40 or $50 a month. Some of them may have went up a little bit higher than that, depending on the plan that they chose.
I'm sorry, Gary, what did you say about the deductible at the beginning?
The high deductible plan. So previously to this year, we offered a high deductible plan, but we didn't offer one with an HSA, a health savings account. So that's something that has been very popular, particularly among people at low risk for needing to use insurance. So typically those are younger people where they are basically gambling to see if they're going to need to use the insurance or not, and they're saving money on a month-to-month basis if they don't use the insurance. Does that help?
Gary, is there a limit on that? Is it $1,000? How much can you put in an HSA?
So the HSA is covered by the state. The contributions are going in by the state, and it depends on the HSA plans. If you're a part-time employee, they contribute less than a full-time employee. But that contribution equals I'll have to get back to you on that. It's something that came out last week, so I'm wanting to say that it's like $83 a month, but I need to get back to you on that exact amount.
Well, Madam Chair, I guess what I'm trying to say is if there's an increase in cost for insurance for employees, we figured that in as part of in this case, the 3% cost of living. So if half of your income increase is going to go to cover your insurance. I don't know if we do that here.
Madam Chair,
Yes.
we haven't factored that in to our increases in the past. We, recognizing the sensitivities with the counties and the desire to maintain what I consider a responsible budget for cost of living of 3% is medical insurance is the least of people's cost of living in our communities today. Rent, mortgages, food, fuel. So that's kind of where I'm coming from. If they have to pay a little bit more in their premium, that's not what's causing hardships for families today, including our staff. Operating cost. So our operating budget is going up. That was what Commissioner Hasbrook mentioned earlier. So it's, if you look at actual operating expenditures over last year compared to projections for next year. So what ends up happening with operating is as we get grants in, if they're primarily, they could be primarily operating costs. That's, we have a budget of over $17 million. So it changes from year to year. It depends on what grants or contracts we get, how that money needs to be spent. So it can be spent in personnel or operating or T&B. So Laurel went over our operating budget to actual. This is our estimate for next year. And it's just a plan that will change. And as that does change out through the course of basically the end of summer and fall into early winter, we'll come back to you with a budget revision for your approval. So this is our best estimate based on last year's expenditures and what revenue we anticipate getting in for fiscal year 24 starting July 1. And like we just talked about with staff salaries, is there's been a significant increase in the cost of everything we purchase to run our business. And that would come out of our operating budget called inflation.
Inflation. And it's really scary when you have a budget that goes up 30% a year.
Right, and so part of it's inflation.
Yes.
Madam Chair,
Yes, Megan.
just a question for Russ. Have we outlined what adjustments can be made based upon the COVID and what staff is on board because of COVID or being paid through ARPA dollars, and if those adjustments can be made or need to be made?
Madam Chair.
Yes, go ahead.
Representative Blanksma, so we have made adjustments in this budget because that's part of the FTE reduction is scaling back on the COVID response revenue. A lot of most of it's coming through the Department of Health and Welfare. It's federal dollars that's allocated to health and welfare. So our shift has been, those of you who are around understand the situation well when COVID first came to the United States and to Idaho. So right now, we're still doing a lot of data entry. That's what's part of our sub-grant. It's very prescriptive. They pay us to do certain work. And then our emphasis from a safety perspective is working with our over 100 long-term care facilities and skilled nursing facilities in our district, because while it's not much in the news anymore, people who are older and immune compromised are still getting sick and dying from COVID. So we've just shifted our strategy. Bottom line is, yes, we've made adjustments in this year's budget based on a reduction in COVID emphasis. Page 5, capital outlay. We have essentially, it's a decrease in the budget, but we still have some building improvement projects. Our facilities are all old, and have to do updates, things like paint, roofs, mechanical systems, but overall cost is fairly low, certainly compared to where we were in past years when we did the remodel of this facility. Trustee and benefit costs have gone down pretty dramatically. And that again is the budget we proposed last year compared to what we're planning to spend this year. What was in the proposal last year was millions of dollars from Ada County ARPA funds, which is what we had requested. And they did authorize, I don't know the exact dollar amount off the top of my head, but a lot of ARPA funding that's built into this year's budget. It just wasn't the total amount that we had requested. And that adjustment would have been made in the February board meeting with the budget to actual and the budget revision. So T&B costs are things that we pay out to the community to do work on, basically on our behalf. Page 6, contract revenue. Budgeted contract revenue decreased. Just talked about ARPA funding. That's where the revenue is coming in. It's contract. We call them sub-grants. Same thing. They're very prescriptive in what we do. You do the work. We invoice whoever's paying us, whether it's DEQ, Health and Welfare, or Ada County directly in the case of ARPA funding. That's how that works. And then we have.
Madam Chair.
Yes, Megan, go ahead.
Thank you. Can we go back to trustee and benefits? I mean, this goes back to the point that I'm saying about asking for the 3%. If you're down 70% on trustee and benefits, but you say that we need to be increasing salaries for employees, I'm just questioning how we justify that to the commissioners.
Madam Chair?
Yes.
So trustee and benefit is money that we would receive to do work, and we pay somebody in the community to do that work on our behalf. The primary money that we're talking about that made this adjustment in the trustee and benefit category was Ada County ARPA funds. So had we received that money would have been passed through us. We would manage it certainly out to the community to deliver services. We did not receive the amount that we anticipated receiving. So that's why that budget is being reduced. It doesn't change our staff. We still have approximately the same number of FTEs as we did last year, minus about 5.
Madam Chair,
Yes, go ahead.
just a question for us, because I don't know, but like, we contract with DQ for this sewer stuff, correct?
Madam Chair?
I mean, they pay us to do that work.
Madam Chair?
Yes, go ahead.
We charge fees as allowed by law for the work we do as delegated from the Department of Environmental Quality. They do pay us for public water testing, small public water systems, but the majority of work we're doing on behalf of basically a DEQ or state law and rule is fee-based.
So, Madam Chair, so a question I have is if you have a downturn in the economy and people aren't putting in septic systems and you've got all these FTEs built up, what do you do with those people down here? Do they go to something else? Are they reduced, taken out, or how does that work?
Madam Chair?
Yeah, go ahead.
We make adjustments, preferred to do that through attrition and not refilling positions, but in the past we have furloughed staff or laid off staff.
Thank you.
Sure. So we have discussed contract revenue and then the fee revenue. We have a fee revenue increase about 1.6%, and those fees will be presented to you in May. They go into effect on July 1. And that comes in two different groups, family and clinic services, fee revenue, and then environmental health. We anticipate slight fee increases. As Commissioner Hasbrook well knows, we don't have much flexibility with the food safety program with the license fee revenue, and that'll be discussed at the Idaho Association of Local Boards of Health meeting this year.
Madam Chair.
Yes, go ahead.
And Megan, I wanted to ask you kind of what your feelings are on us even approaching the food fees. Do you think that's politically possible? Or is it?
No.
Do you have any recommendations?
Well, it's, I guess I'll just be honest, it'll have to go through health and welfare in the House side, and you probably don't have the votes to move it. So however much you want to push, you can push, but I don't know that it will move. And I was going to bring that up later, but.
Yes, go ahead, Al.
Well, and I think that's part of the understanding that, like maybe in Raul's case with the 80 county commissioners, the fact that right now the counties realize we're subsidizing that food fee cost $1.7 million a year. So when you talk about statewide, so when you talk about we're trying to reduce property taxes, this is one of the ways we can do that. But we can't get it through the legislature. So those are kind of the things that we're up against, trying to reduce that cost on that budget. So.
Madam Chair?
Yes, go ahead, Megan.
Yeah, I would just say that that is so marginal when you're talking to food fees to make the argument that property tax reduction would be in any way substantial based upon food fees is probably not the best argument.
I'll stay out of this food fund.
Madam Chair.
Yes, go ahead, Al.
Well, I appreciate that, Megan, but I think, sitting in a county commissioner seat, those are the kind of things we ask ourselves. Why are we subsidizing that cost? And we could use any help or all help, because this is going to be the hot discussion at IAB in June, is how do we get that fully funded by food establishments? And it's definitely a subsidy from the taxpayers of Idaho for that inspection process. And any help you can provide would be appreciated.
Madam Chair?
Yes, go ahead, Megan.
Thank you. I think on the other side of that coin, the argument is going to be that it's a state requirement and it's a government requirement. And so in a way, why should the food establishments fully fund it when it's a government requirement? That's going to be the argument that you're going to have.
Okay, thank you.
Madam Chair,
Yes, go ahead.
page 7. Other revenue and interest. As Laurel presented earlier, even after we made a budget revision adjustment in February that you all approved, interest rates have continued to go up. So we've adjusted our anticipated interest revenue up accordingly. And that could change, as we know, and it could go down or it could go up. And we'll talk about that more once we get to the end of the calendar year and have a new picture. Reserve funding, that's $166,000 related to funds that we received in advance in fiscal year 23 that will be used to pay out expenditures in 2024. Once again, Laurel talked about that, the money we received, like the opioid settlement, some of the organizations paid a lot more than if you amortized it out over whatever the period of time would be, up to 18 years. Then on the last couple of pages, you will see the detail of all the services and programs we offer, including lots of acronyms. And I just include that just for your awareness, but if you do have questions about it, let me know. As I stated at the start of the conversation, this is an action item. And I am asking for your approval to approve this proposed budget, which then will be presented to our counties and then voted on Friday, May 12th. Before you have discussion, I just would share with you the data sheets that we put together. That doesn't get down into fixed cost or other costs by county, but it does show essentially what we do for the counties we serve. This is not everything we do. These are the highlights. And that's what I share with the county commissioners so they understand a little bit more detail about the services we provide to your community. So with that, I'll conclude my presentation. Stand for any questions.
Any questions, further discussion for Russ? If not, I will call for a motion.
I do have a question.
Yes, go ahead.
And this may have already been asked, but your 3% is mostly, you think, to give increases, but we already came up with a plan, right, for the, there was a plan that we voted on that we all approved, that we were gonna give a certain increase to people, and then there were some bonuses and other things. That's included in the amount of money that we already had budgeted. So this increase is not needed to comply with the plan that we voted on. I can't remember when it was, a few months ago.
Pension plan.
Yeah.
So the salary increases last year were part of the county contribution increase. So this is for next year. Maybe what you're referring to is the retention incentives. That was one time. Those were paid out in December. So that comes out of one-time costs. Salaries are ongoing costs. So in order to do a 3% increase, cost of living plus 2% merit for our staff this year, that's part of the 3% increase from the counties.
And follow up.
Just go ahead.
Is there any way to reduce costs? Because you said that there's only 3 ways to do this. One is reduction of employees, the other one is reduction of services, but the third way is just to reduce the overall cost that we have. Is there any way to find savings in that area?
Madam Chair.
Depends on inflation law.
Yeah, there's a lot of factors. I mean, we're a service delivery organization. So if we want to cut cost in environmental health, we could not do all the food inspections required by law, and then you face consequences of that. If we want to cut cost in WIC, a pregnant woman may have to wait 30 days to get enrolled because we're already short-staffed as it is, by the way, even though according to our sub-grant, we're required to see them within 10 days. So then what they do is they penalize us and they provide less payment for the services we offer. So, there's always ways to cut costs, just like the family budget at home, but it's not without some consequences. So,
Madam Chair, may I add to this as well? So for this fiscal year, we have made some adjustments to what we would typically spend. We had a plan to purchase 2 new vehicles this fiscal year, which we decided to wait on. We have 2 trucks, one that has some mechanical issues, but not a lot of miles on it, just typically had issues, and then one with over 200,000 miles that's still running well. We decided to wait on both of those vehicles, so this budget does not include the purchase of any new vehicles. And then, as you saw with our capital outlay plan, capital expenditures, we're not planning any huge projects with the one-time capital cost this year. So in answer to your question, we are planning some of those cutbacks to be able to continue to provide the level of service that we have. So those kinds of things like the family budget comparison, the things that we can wait on, we are.
Thank you.
Any further? Okay, do I have a motion?
Madam Chair,
Yes.
I want to go back a little bit and talk about the issue with personnel. We're looking at about a $700,000 increase from last year, just in personnel costs. We're gonna have about 34,000. I think it's gonna be higher interest revenue coming in, so we're looking at a $470,000 increase for staff. The only way that I could see that we could drop that cost more is to allow for a 3%, but not allow for the 2% merit. And that's, to me, is a kind of a bad signal that we're sending to employees, that you're gonna get a 3% raise, but the people that are outstanding, doing a great job in their departments, we can't do a 2% merit. And I think this board needs to ask themselves if that's the message you want to send. To me, we look at not only the cost of our medical premium for the county employees, but we figure that in as part of that 3%, so that you have to kind of remind folks. That's why I was talking about so long that, hey, your premium now costs us $1,200 more a year. So that should, to me, should be considered part of your salary increase, even though you're not going to see it in a paycheck. This organization is covering that cost. And whether or not you want to do that is another question you have to ask yourself. But I think it's important that the employees know that, hey, we're picking up that tab.
I do too. I'm sorry, Madam Chair. I agree.
And then the other issue is the spouse and families. Like I said, we've gone back through and said, we're not going to pay 60% of that premium. We're going to try and get it back to 50-50 to make it fair with everybody, with employees that don't have family or don't have kids. It's the only real fair way you can meet them in the middle. And I think those are things that we need to seriously discuss and talk about and see. The other issue is that, and maybe Gary, you've done this, but have we done a salary survey? How do our employees, I know we have, what, 2 years ago?
We have them. Gary can speak to it.
How do they match with the rest of the districts and the rest of the people in Ada County and in our district? Are we in the middle? Are we low? Are we high? I think those salary surveys are, to me, are kind of really important, because if we're not, we're going to lose employees. We've got to be in the top end of that survey, or we're going to just be hiring folks, and you're going to be, revolving door all the time, and that's not really good for this organization.
Madam Chair.
Go ahead, Gary.
So we did do another salary survey, and we are making some progress from where we were when we initially started. We had a significant amount of employees, especially within specialized fields such as environmental health. We had some in the medical areas that they were in the lower range. We made some progress on those. We are, by and large, in the 25th percentile or less for most of our staff compared to what they get in the private sector in Ada County. We focused on Ada County because that's who we're competing against, is Ada County primarily. We did include Valley County and Boise and Elmore County as well in there, but the majority of our employees are right here. So being in the 25th percentile, we also have to look at what our benefit package is compared to if you were to go to work for St. Luke's as an RN. We know you're going to make a significant amount more money salary-wise, but you're also going to pay a significant more in benefits. So that brings most of our employees up into the 40th to 50th percentile, depending on the position that they're in. So we are not we are not exceeding where we should be. I would venture to say that we are probably 8 to 10% below market average when you take the entire benefit package and everything into account. Does that help?
Thank you. Yeah, I appreciate that. It concerns me, like when Laura was talking about losing a really good employee to someone else in our business department. I mean, those are the kind of things we can't do. We can't lose those kind of folks. And it's a constant deal. The thing that bothers me, and I know it bothers Megan too, is the fact that it seems like it's almost an automatic every year that we go up 3%. And if the economy tanks, everything changes very quickly as far as, it's not going to be an automatic kind of a deal. And I think we recognize, I know Russ recognized the fact that there were years we didn't ask for that because things weren't as good as they are now. So, but when they're good, we need to treat employees better. Personally. And it's hard, especially when you're the one where the buck stops. So Madam Chair, I'm going to go ahead and make a motion that we accept the FY '24 budget as presented.
Okay, thank you, Bill. Is there a second to that?
I'll second.
Okay, thank you, Clay. The motion has been made and seconded to accept the proposed budget for 2024. If there's no further discussion, I'll call for a vote by county, starting with Ada County and Dr. Young.
Jane Young, aye.
Ravel, Labrador.
Yes, but I do need that information that, so, yes, with reservations.
Okay, Dr. Cole.
Aye.
Commissioner Tucker.
Yes.
Representative Blanksma
Aye.
and Commissioner Hasbrook.
Aye.
Okay, that proposed budget is approved. Russ, thank you so much for your hard work.
Thank you for your approval.
Okay. All right, proceeding with our agenda, we're talking about proposed resolutions for IAB.
Okay, Madam Chair, so there's two proposed resolutions in your packet. We have not received any additional, and both of these came from Public Health District 3, which is based out of Caldwell. So the first resolution is one that has kind of a long history, as you can see in the adopted notes at the bottom of it. And essentially, Commissioner Hasbrook has already talked about this. He's been really involved as the executive council member and trustee for Central District Health for a very long time.
Too damn long.
So we're now revisiting it once again, we being the boards of health, not the staff, to remove the license fees from Idaho code and allow the boards of health to adopt fees just like you do for pretty much everything else we do. So that's resolution, the first resolution I have to share with you. And by the way, we're not voting on these today. This is just for your information. You will vote on it at the annual meeting that's June 8, 9, 10 in Coeur d'Alene, Idaho. And we'll talk about that a little bit later in the agenda. Second resolution is a resolution to support the increase of collaboration, funding, and access to life-saving tools to prevent and reduce fentanyl overdose and poisoning. We got the whereas statements. Obviously, we got a problem in Idaho and across the country with drug overdose deaths. And the be it resolved statements for this is essentially to continue supporting funding. Most of that funding or all of that funding is coming through the federal government, either through grants or through the opioid lawsuit settlement, which continues to increase revenue coming to the health districts. Many of you, or most of you are probably, or all of you may be aware of some shift with the legislature. Representative Blanksma can speak more about this, where the appropriation spending authority for the state of Idaho that was allocating money for things like naloxone was restricted to be for first responders only. We do work with a lot of other community responders and with the Idaho Harm Reduction Project statewide. According to their data, the implementation of life-saving measures for opioid addiction was something like 90% non-first responders saving the lives of individuals. So I think that's what this is about from Public Health District 3, is the idea we do need to work with a lot of our community partners, not just first responders. And then the very last one is legalize fentanyl test strips. What's happening is people are using drugs, illegal drugs, presumably prescription drugs, that have been laced with fentanyl. They don't know it, they take it, they overdose, and some die. There you go. There's 2 resolutions for your awareness. If you have any questions, I can try to answer those or provide feedback.
Madam Chair,
Health District.
Yes, Megan, go ahead.
I'm going to assume that Russ wants me to kind of speak to what happened with the naloxone, just based upon his comments. What happened, just as background, as far as the legislature, and it ended up as intent language in the budget. The Department of Health and Welfare was misconstruing a section of Idaho code. And for those of us who've been around for a while, it was the needle exchange code that I ran at one point in time that I think Russ and Betty Ann, you guys know what I'm talking about. They were trying to run their naloxone program under that section of code, and it was inappropriate, and that's why that happened. I think going forward, we can make some changes as far as how naloxone is distributed, but that was the reason why it was Department of Health and Welfare was setting up a program inappropriately.
Madam Chair.
Yes, Al, go ahead.
So Megan, where do you get naloxone now? I know the county, we get a lot of that stuff from the health districts, but where do the health districts get it from and who pays that tab?
Madam Chair, what was addressed in the legislature was the state funding for naloxone and then the federal pass-through and who would have the ability to use it based on it was needle-based delivery. So there wasn't a carve-out for naloxone as far as this whole needle exchange thing went along. And so we're going to have to address that going forward to make sure that we can have an expansion of naloxone delivery, but not have it under that particular section of code. Does that make sense?
Mm-hmm. Madam Chair.
Yes, go ahead, Al.
I know in our county, what we've done is we've gotten a lot of stuff from the health districts. We've even got a stand not a stand, but a thing on the wall in our county courthouse that has, I think, 6 or 8 naloxone nose deals in them so that they're available. But can we use opioid funds to purchase those?
Madam Chair? Yes, we can.
Because I think that's going to be a good use for opioid.
Mm-hmm.
I'm interested in the test strips. Are those something that you hand out like to homeless, that kind of stuff, or how does that work?
Yeah, they would be provided to individuals who are users of drugs that are at risk for being either, I mean, if you're taking fentanyl, you know you're taking fentanyl. If you don't know it, these test strips would identify it in drugs that you wouldn't anticipate. So they would be provided to community partners and organizations that would serve individuals like substance use treatment facilities with the goal of helping an individual identify whether the drug they're taking is laced with fentanyl.
So, because I just don't know this, so if someone gets a bag of fentanyl laced medication, do they have to dissolve this tablet and then test it to see if it's, I don't know how that works.
Madam Chair, I don't either.
And how about the schools? Having access to those too, because we're seeing all the candy laced fentanyl and stuff.
So Madam
Point.
Chair, it's illegal right now for those to be used in Idaho. So that's what's being proposed in this resolution, is to allow fentanyl test strips to be purchased and used in the state of Idaho. So if the IAB, the Idaho Association of Local Boards of Health, approves this resolution at the June meeting, then the plan would be to hopefully provide direction to the public health district directors working with the Idaho Association of Counties to change Idaho law.
Madam Chair.
Yes, go ahead.
And Russ, I read somewhere the other day, and it might be, that's probably true. It's hard to believe that already since the first year in Idaho, we've had 360 people die from fentanyl overdose.
360.
Madam Chair, I don't know the exact number, but it's hundreds. Madam Chair, is there anybody have any comments on either of these that they would like me to share with Public Health District 3?
Madam Chair.
Yes, go ahead.
On the first resolution, I just don't see any way that the legislature is going to approve that. And one of the principal issues that I see with it is removing it from the Idaho code to give it to the districts. You don't have a duly elected body setting fees. So we don't get voted on as board members by the public. And I just don't see the legislature trying to transfer something like that, because they usually when you want to raise fees, you want it to be a body that is responsive to the people. And if you screw up with your setting of fees, then you're going to pay a price to the electorate. So I just don't ever see this ever happening. I would probably oppose it. I'm not going to the meeting, but I would probably oppose it. But I think that's going to be just a problem to get that through the legislature, in my opinion.
Madam Chair,
Yes, go ahead.
so if you're not going to attend the meeting, then you will be given the opportunity to provide a proxy to one of the board members who will. Proxies could be either general, like, hey, vote on my behalf, or I want you to vote this way on these resolutions. So that's something we'll talk more about at
And you're gonna line all that up.
the May meeting. Yeah, so we'll have those ready for the board members who are not attending. I would encourage you to provide proxies, otherwise we're missing out on the opportunity to vote and be represented at the association meeting.
Yes, go ahead.
And just to reiterate what Russ said, I have seen resolutions fail because we didn't have enough proxies.
Right.
So they are important. If you can get them to Don or whoever's going to do that work, they're needed.
Okay, Russ, are you through?
On that item,
Okay. You want to talk about this, the district?
sure. So a question has come up about where we invest our money. So we invest our money so that it's not sitting earning nothing, although for the longest time it was even invested was earning very little. Now it's earning a lot more, which is part of that interest revenue component of our budget. But we are required currently by law 39422, which I think is in your packet, to invest the money in a special account with the state treasury. So if this board or all the boards wanted to change that and be able to have more flexibility in where the money that we receive through the various sources, it would require a change in Idaho code. So I just wanted to make sure you are aware of that, because with the annual meeting coming up, it'd be a good time to discuss it. If this board was interested in that, I don't know if we need to go through doing a resolution, but I guess I would envision it starting with the Board of Trustees / Executive Council, and they meet on the 8th in the afternoon of Thursday, June 8th. So I put discuss and vote. You don't need to vote on it. I just wanted to make sure that was there in case you chose to, but maybe I could turn it over to Commissioner Hashbrook. I know you're.
Well, the counties are going through this thing here, similar situation for quite a few years. We can only invest our extra funds in the local government investment pool. And we asked if we could pull that money out and invest it on our own through our local treasurers, which we have been doing. And I'm interested, or I'm honored to say that a lot of us have a lot of ARPA funds and opioid funds that we know we're going to spend eventually. And so we've been able to invest in 3-month and 6-month CDs. The last one we got was last Monday at 4.9% interest. And so we're making pretty good interest rate off that for the taxpayer that we hope will come back in and subsidize that budget, which will hopefully reduce your levy rates and costs and that kind of stuff. But I think it's an opportunity that we should have as a health district as well. So I think this is one of the big things I'm going to talk about in IAB up there, is if we need to come forward with a resolution asking a change in the code, that we can do that. It might be kind of tough because in counties, of course, it's an elected position, the treasurer. Whereas in this situation, it's not an elected person, so if they blow it, and lose money or lose the investment, what's the response? So that's gonna be the challenge, but we should be given that opportunity, I think. That's all I got to say.
Any discussion, this issue? Now, Russ, you have this down as action item.
Hmm?
And how do you want to phrase that to?
Madam Chair, I included that just to comply with open meeting laws. If the board wants to vote on that, if you choose not to take action or not vote on it, that's fine.
Sure. I guess my thinking is, would you guys support a resolution coming out of the executive council for this very fact, or if you want me to just shut up and sit down and not bring it up?
Madam Chair,
Yes, go ahead.
I just don't know enough about this, and it's a brand-new issue. I don't know that I would support it or not support it. I'd like to hear what Megan has to say about this, and I think it's the same issue. You actually raised it, that the problem is that right now we can easily pick out these 3 and 6 month CDs, which are working out really well for the people that can. But what happens when all of a sudden we pick an investment like the banks just did, and that closed down, and they lost a lot of money. So those are the things that I worry about. When you go through the treasury, at least they're making investments that are being vetted by a bunch of different people. The treasurer has, it's an elected official who's
Right,
making
right,
those decisions. So I have a lot of questions. I'm not a yes or a no, but it's a new concept to me. So I would be against putting anything forward right now. I don't know that it's a bad idea or a good idea. I would be, if a motion were to be, proposed, I would probably vote no right now.
Yes, Megan?
It's me.
Yeah,
Oh,
Madam Chair,
Okay.
yeah,
It was Laurel. I'm sorry.
but I do have a comment, since the good Attorney General just kind of threw me under the bus there, but it's okay. I'm actually in agreement with him at this point, because if you're talking about investing dollars, and potential losses, I think that you really have to look at what the accountability structure is there. And so, yeah, I would want to vet the issue more than I am prepared to right now.
Okay, thank you. Laurel, go ahead.
Thank you, Madam Chair. It's not something Conan and I have discussed, but Bailey and I did discuss it when it came up at past board meetings, and her feeling was in alignment with Raul and Megan that it's a big responsibility to put investment on the level of my responsibility or the financial manager position, and the potential for loss there. And I agree, right now it might be fairly easy to make some safe financial decisions, but that's not always the case. And we know the LGIP is just a trusted place for investment that feels very safe and structured. So that was the input from the financial manager level after having discussed it the past couple of times. I think there's also some restrictions on interest earned on federal funds and how that money can be spent. And like that came from Bailey as well. So I'm not sure what they are, but she was very familiar with that. So just more things to consider. Of course, as staff will comply with whatever the will of the board is, but that was kind of discussion items that we've gone over in the past.
Well, I know, Madam Chair,
Yes, go ahead.
I know on the county level, what we do is the commissioners will say, okay, we want you to invest this money in a 3-month, or we're not going to need this money for 6 months, and we make that motion, get it in the minutes, get it approved, and then the treasurer does the function. So we would be the ones that are, the buck stops here, kind of, so to speak. But I'm telling you, it's a much better investment than the LGIP as far as return. Much better.
So do we want to just consider this an informational item at this point? Is that the flavor of the board? Okay. All right. Okay, that brings us to the district director's report.
Okay. Already mentioned it a couple times. The Idaho Association of Local Boards of Health annual meeting will be in Coeur d'Alene this year, hosted by Public Health District 1 and Handle Health District. It's Thursday, June 8th, Friday, June 9th, and Saturday morning, June 10th. The afternoon, Thursday afternoon is just a meeting of the Executive Council, and then the main meeting for all board members would start on Friday. And then I think it's set to end at about 10:30 on Saturday. If you would like to go and you haven't already let Donna know, please do that. You can do that today or through email or text or however you want to communicate with her so that she can help make any arrangements you would like assistance with. Central District Health would pay for your travel, hotels, registration fees, and then Board of Health members receive $75 a day for any meetings they attend. So that's IADBH for 2023.
Madam Chair,
Yes,
what time did you say it started on Thursday at noon?
Madam Chair,
yes, go ahead.
I believe the Executive Council
I don't think I've even seen an agenda.
meeting starts at 3, but I'll make sure, I don't know if they ever finalize the agenda. Is that?
It's posted on the, I can get it, I'll send it to you, it's hard to get to it, I will make it easy, send it to you guys.
So Donna will send a copy of the agenda to everyone after this meeting.
Yes, go ahead.
Where are the meetings and do we know, I'm assuming we do, but
Yeah.
where are they going to be?
Madam Chair, Hampton
At the Hampton and then Coeur d'Alene.
in Coeur d'Alene. So it's at a hotel and conference rooms right in Coeur d'Alene.
But it's not at the resort, different hotel, I'm sure.
Right. And as noted earlier, proxies will be provided to all of you at the May meeting and electronically. So if you're not planning to attend, you can give direction to one of your fellow board members who will be attending, and we should know by then who else committed to going. The budget hearing schedule, you should have all received appointments for your respective counties. Obviously, Commissioner Tucker, Commissioner Hasbrook, hopefully you'll be there when we visit with your county. And then it was sent to the other board members based on who appointed you to serve on the board. And I do appreciate you being there. I think it's good to have your support when we make the budget presentation, and ultimately that may help guide the vote on Friday, May 12th at 10 a.m. That will be at our Mountain Home office. And the schedule, Boise County is going to be Tuesday, April 25th at 11 a.m. Elmore County, Friday, May 5th at 10 a.m. Valley County be Monday, May 8th at 1 p.m. And then Ada County will be Thursday, May 11th at 1:30. And you had sent appointment reminders to all the board members. So, and Donna could send this out to all of you too, what I just read off, just so you have it, but you should have a ability to accept the appointment if you're able to make it on those dates and times. Next, there's only 2 more items. One is upcoming elections for the 3 positions on the board. So you have a chair, vice chair, and then the trustee/executive council member. Currently, as you know, Betty Ann's our chair, and she has served 3 two-year terms in that role. According to the bylaws, you can serve 4 two-year terms. So,
Now, wait a minute, you're not gonna do this to the trustee position too, are you?
Madam Chair.
I can see the train.
Yes, go ahead, Russ.
So the trustee/executive council member has served for 2-year terms.
4, so I'm done.
You're termed
Yeah.
out
Yeah.
for that position.
Mhm.
And Representative Blanksma in the vice chair position, like Betty Ann, has also served 3 terms. So that's not to decide today, but in May, you will need to vote on who you want to have represent you on CDH board as the chair, vice chair, and trustee/executive council member. Then the last thing I have is we get comments from the public that go to a Board of Health website or Board of Health email. And some of those comments will be things like, how do I get a septic permit? You guys know the rest of the comments. So what we have historically done, and for the administration, for the staff, is if somebody wants to know how to get a childcare license, we will have our staff respond to that. Other comments, I guess bottom line is we've been, I would call it a bit judicious to decide who we respond to and how we respond. And if it's something that's based in law or based in something, services we need to provide, then we will respond, others we don't. So the whole comment section started around the time of COVID so that the public would have the opportunity to provide comments and they wouldn't have to attend a meeting in person. We get the comments, we cut it off 24 hours ahead of the meeting. Donna packages those up for you and sends them to you. But I'm kind of thinking about going forward, how you might want to handle that. I've talked to Maria, our communications and marketing manager, about a possibility of putting on the website that make it crystal clear if you're sending a comment to boh@cdh.idaho.gov, my thought is agency staff will not be responding to that. If you have a question about the operations or licensing or anything else, however we would describe that, send it to this email. So I don't want to say that the comments won't be responded to, because that would really be up to you all to decide if you wanted to comment, to respond to those comments. But I just feel a little uncomfortable being put in a position of not responding, but then I don't think it's necessarily appropriate for staff to respond. So right now, what Maria and I talked about is just making it real clear that if you send it to this email, you're providing comments to the board for which CDH staff will not be responding. And if you have questions for the agency, questions for the board, then you send it to this email. So just wanted to get an idea if you guys like the sound of that. We could certainly present to you in May what this will look like, and then we could implement it. We don't need to do it right away, but
Madam Chair,
Yes, go ahead, Rob.
Russ, I assume when you say if you have comments about something else, send it to this email, that it will have a link right there so they can easily send an email to the appropriate place.
Madam Chair, that's correct. So we would just want to make sure, I'm kind of envisioning them both being there side by side, and you either click on BOH@CDH, which is the comments to the board, and then have, if you need any assistance from the agency, click here. And we do get a lot of emails that come through to various avenues that we would respond to. It's just really the Board of Health ones were, at one time, those of you around, I think we got like over 3,000 between board meetings, and we could not respond to all of those. But more recently, we have been trying to respond to the ones that we think are appropriate for us to respond to. So yes.
Madam Chair,
Yes, go ahead, El.
first of all, as a board member, I want to see those comments because I want to know what the feel is out in the community. However, if somebody comes in and says, how do I get a septic permit or childcare? Those are Maria and yours function is to follow that. The issue comes down to when you get 1,000 a day, you don't have time to deal with it.
Yeah.
And the hopefully that's kind of faded away now with the coronavirus fading away. It's not as bad. We used to get a lot.
Mhm.
That's my feeling. Day-to-day operations, you guys can handle, but any overall comments? And then if we feel like something needs to be commented, it's got to come in front of this board and we all got to agree with that comment or that comeback is going to be. We can't each individually do that because that will get you in trouble really fast.
Go ahead.
Madam Chair, I was just going to say, so the volume is way down. We do pass all comments on to you. You know, it's we get spam like all other emails. So I've asked Donna to remove those. So you're not having to look at some advertisement. If it is about something we respond to about a septic permit, we've generally been providing those to you as well. So you can see those. But I guess it kind of comes back to, you guys have seen the comments, so you know what I'm talking about. I don't want our staff to feel like they need to respond to the emails that are sort of directed toward board members or whatever, qualifications, things like that.
So maybe what we need to think about is a policy that you and Marie could work up that this is how we're going to handle each one of these different responses. We'll do the day-to-day, how do we get a permit kind of stuff, and a policy so that protects both you guys from commenting on something that you shouldn't comment on, right? We have policy that doesn't allow me to do that. Because you might get somebody from the press who wants to know how you feel about this.
Madam Chair, yeah, there can be comments like about how does a board member, how did somebody get on the board? And we say the county commissioners appoint them and it's all in law and it's voted on. And I don't have a problem responding to those, you know, I guess hopefully we use good judgment to this point. But I think from a public perspective, that's what I'm interested in, is making sure the public is clear on the expectations so that they're not waiting for, I sent this comment and I'm like, I'm not responding to that. And then they come to you later and say, Russ never responded. And I think I'd rather make it more clear to them. So that is, I think maybe in May, probably be a good time to
talk about these.
Are we going to go over any of those? Just what?
This was in the packet that we
I
never.
think, is that just for information?
Well, I was going to say, Rel, this might be something you want to take to your county commissioners.
Yes, yes.
Yeah, I saw that.
Good information. Did
That
you
was
do that?
excellent information. Yeah,
Good, good, very good.
right.
Yeah, this is the kind of stuff we need to PR out.
It is.
Madam Chair.
Yes.
So those documents will be in the budget packet. So when we go meet with the commissioners, they'll have that. And I'll talk about it briefly. I'm not going to read the narrative in the last couple of pages, but just highlight the data. And it is, as you can see, county by county.
Good, thank you. Yeah, that was very helpful. Are you done?
I'm done
You're done. Okay.
for today.
All right, well, I think this brings us to the conclusion of our agenda for today, folks. And as previously mentioned several times, our next scheduled board meeting will be held at our Mountain Home office, May 12th at 10 o'clock a.m. This is a joint meeting for the Budget Committee and a regular board meeting. So at this time, I would like to thank everybody for their participation and their input, as well as the public who has chosen to attend, be it in person or online. And at this point, I'll entertain a motion for adjournment.
To adjourn.
Okay, thank you. A second?
Second.
Okay, thank you. Any further discussion before we call for a vote by county? Okay, hearing none. Ada County, Dr. Young.
Jane Young, aye.
Rel Labrador.
Aye.
Dr. Cole.
Aye.
Boise County, Commissioner Tucker.
Aye.
Elmer County, Macon Blanksma.
Aye.
Valley County.
Before I vote, I'm just glad everyone's here. It's great to see everybody and
Yes.
showing up. It means a lot when we have enough quorum we can vote, so I'll vote aye.
Okay, thank you. It's really nice to have a full house. Okay, thank you. That motion for adjournment has passed, so have a great day, everybody, and maybe spring will come someday.
I have laptops coming so that we can